It's done. Finally, the chest you've always wanted.
I have this.
Thank you.
It is done.
So proud of you.
The fact that like the South is conservative as it is, when I was early on in transitioning, I was more androgynous, and of course you go through that stage. However, I was with a group of friends and we decided to go to a restaurant, and everybody's like, all right, well, we're gonna go to the restroom before we order, no big deal. And one of them went into the women's restroom, and the guy was just like, well, why don't you just come in here with me? Like, it's fine, like I'll be in here. And so we go, and I'm like already sweating because I'm freaking out. And I come out of the restroom, didn't realize that he had already came out. And an officer was standing in the front of like the restroom. And he was like, I need to talk to you. And I was just like, okay, well, now here we go. I can't do it. And he was off duty because apparently he was at a set of booths in the center of this restaurant, and he had seen me. And he like got me close to his table, stood in the middle of the restaurant, berated me about who I was, if I thought I was in the right restroom. Like, it was the worst experience I had ever like dealt with in full-on embarrassment in public. And I've done some really weird things, but that was a lot. And so I learned very quickly that if I'm gonna go out in public, I know how to dehydrate myself enough to not go to the restroom. And I also know how to hold it for an extended amount of time because I was terrified. Still am, but not as bad as I was. And it's still stuck. Yeah. I just cannot not do it. Makes me weird.
It was like that on the trip out here too, like when we had to stop in random places.
Oh yeah. No, I'll find a bush or something, I don't care.
Do you think after you get your top surgery, that's gonna help with the trauma around using the restroom?
That, and I think the top surgery will, because then I won't feel as like, okay, like this is gonna be noticeable, and then that's gonna be, you know, and it just kind of like the layers, but also moving to an area that really has kind of opened the door to allow me to be myself, and then kind of move through the world like I should have been able to prior.
I have gone into the women's restroom before and have literally had a mall security guard follow me in there and make me show him my ID, which is probably the most like awkward, demeaning thing I've ever been through. And I'm just like, why would I come in the girls' bathroom and tell you I'm a girl if that's not really why I'm in here? And I just let it roll off the best I can and just, you know, don't say anything to them, because at the end of the day, you're not gonna be able to argue with ignorant people, so just let it go.
Have all your questions been answered, and do you verbally consent to this procedure?
Yes. Oh boy. I think the age that I felt like I knew for a fact that I was different, I'd say probably around the ages 5, 6, somewhere in there. Whenever you start to come into your own person, your own being, and you're picking out your favorite colors, your favorite clothes, the things that you like to wear, the things you like to do, I started realizing that I wasn't really enjoying the pinks and the dresses and the things that most girls liked. So I started feeling really different then, like I didn't fit in. And one of my earliest memories would be Valentine's Day at school. When I was in like kindergarten or first grade, it used to be like the girls bought Valentines for the boys and vice versa. And I remember making my Valentine's Day box and going with my mom to the store and her asking me like which Valentine's Day cards I wanted to get for the boys. And I just felt super wrong about that. Definitely wanted to give Valentines to the girls and did not want to give any to the boys or receive any from the boys. I've always just felt like I belonged with the boys, like never understood why they were getting to wear those things or have those haircuts or be who they were, and I didn't feel like I was a girl or that I even fit in with the girls. There was actually a time I got in trouble when I was pretty young for taking my shirt off because the boys had their shirts off. And I wasn't old enough yet to be wearing a bra, so I guess it wasn't too awkward for everybody involved, but I did get in trouble for that. I do remember the first time my mom told me that I had to buy a bra and had to wear one and being completely mortified and just upset. Didn't want any part of it, it just didn't feel right. I just didn't want to wear it, didn't want to have anything to do with it.
My name is Killian, and I am 30 years old.
Perfect.
That's the best time of your life. It's fine.
Exactly. So, what are your preferred pronouns?
He, him, and they.
So, is your family supportive of your transition?
No.
Yes and no. Crystal is.
So my family entirely is not. My sister came to terms with the fact this is just how it is, and she kind of already knew. And that was honestly her like later comment was like, I already knew, I just didn't want it to be a thing because the religious family already had an issue with it. And my mother, her first comment when I stated it was, well, you killed my daughter. Yeah.
Which is not fair because you're the same person you always have been.
Right. I didn't go anywhere.
You're just not the person that she thought you were.
Right.
You didn't kill anything.
Right. And that really fucking sucked.
The thing is, she wanted a person that didn't exist in the first place.
Yeah.
Once I started feeling like actual dysphoria later on in life due to the changes that my body was, taking and becoming more feminine, I didn't feel like I wanted to just lay down and accept that. I knew I had to do something about it. I just didn't know the right way to go about it. And these classes that my sister and I go to the same college, and these classes that we were taking opened up a great avenue for us to have a conversation. And she was writing a paper on a transgender child who was 6 years of age when she told her family that she didn't feel like she was in the proper body. She was born a male, and my sister made a comment and she asked me, like, how do you think a kid that young could really understand and grasp that they feel like they're in the wrong body? And I kind of just laughed and was like, trust me, she knew. And it was like the light bulb instantly came on for her, and it just all clicked for her. And she literally looked at me and was like, is that how you feel? And I was like, yeah, it is. And then she cried, and we talked about it, and she asked, you know, how long I've known, and then we just kind of got into this really deep conversation that lasted for hours, literally. And that happened on like a Tuesday night, and Wednesday I outed myself to the entire world, all my family and friends on social media, and by that Thursday I was on testosterone for the first time. So it happened very, very fast.
This is my voice after 2 injections of testosterone. This is my voice 1 month on T. This is my voice 2 months on T.
This is my voice 1 year on T. This is my voice 1.5 years on T. It was pretty difficult to find people like me or my tribe. I found other people who were part of the LGBTQ community in the various cities that I've lived in, but it took me a long time to find somebody else who was transgender that I could like share that experience with and kind of just like confide in. I actually started looking at people on like Instagram, TikTok, things like that, and those were kind of the people that I started to like look up to and just, I mean, really be jealous of for, you know, living their true lives, being themselves and not being afraid to be who they are. But it is difficult to find people who you can relate to and just share experiences with, and I'm hoping that by putting myself out there like this, I can meet other people that are like me so that we can share similar experiences and just kind of help each other get through, I mean, life in general. My name is Kai. I'll be 34 years old this Sunday. My preferred pronouns are he, him. I grew up in Lancaster, Ohio. I'm one of 3 children. I'm the oldest. Upbringing was fairly normal, just everyday kids doing everyday kid things. Yeah, played football, joined the military when I was 17. Wasn't like most other kids, I guess you could say. Didn't really fit in with the normal girls, if that's what you want to call it. I always had short hair, always presented very male. My parents were super great, open, allowed me to just be, you know, who I wanted to be. They didn't fight me on anything. Whenever I was old enough to decide how I wanted to dress or do the things I wanted to do, they were completely supportive. Helped me pick out the boys' clothes that I wanted. My dad hunted with me, took me to get my hair cut. So I was very lucky to have the family and the people that I had growing up. You're knocking off over there. So after my conversation with my sister and the overwhelming task of outing myself to everybody I know for the second time in my life, I immediately got on the internet and was doing research like crazy. How can I get HRT? What does surgery entail? Like, does insurance cover that? It was a lot of information to go over in a short amount of time, because of course you get super excited. Like you just told everybody like, hey, this is me, see me for who I am, and now you're just ready for everything to just be done. Like, I want a beard, I want a male chest, I want, you know, everything I can have, and it just unfortunately doesn't happen that fast. But I found some websites that you can use to start your HRT therapy. Because I live in South Georgia, where not too many doctors are willing to deal with people like me, I had to find alternative methods, and these websites were a huge help for me. So I did some telehealth, talked to a doctor through a Skype meeting, and she broke down everything for me, and I started testosterone literally that night. She sent me the prescription that day, I went and got it, took my first shot that night. So from the time I came out to the time I started HRT was literally a 3-day process. And I've been taking shots once a week ever since then. And I've been growing facial hair since day one. I literally had like 7 hairs for like the longest time, and I felt like I was never gonna grow any hair at all. And then all of a sudden now I look at myself in the mirror and there's facial hair there, and it's just more and more every day. I mean, still patchy, but it's coming in. I guess that's all that matters. But it's been really neat. The voice changing happens right away. I've been doing video logs of every month of my voice changing, you know, saying the basic, this is my voice 1 month on T, all the way through a year and a half. And it's been really, really cool to go back through those videos and just see how drastic the change is. Because when you see yourself every day and you hear yourself every day, you feel like nothing is changing. And then you go back through these videos and you're like, who is that person? That doesn't even sound like me. I don't even recognize that person anymore. Like, you actually feel like you're living for once, like you're like living life the way you were supposed to live, and it's not like this dark cloud that's over you all the time, and you feel like you're hiding, and you don't want to go in the girls' bathroom. You don't want to have to explain to somebody, yeah, I'm a girl, yes, that's a girl's name, yes, I know. Like, it's just, that's all just so frustrating, and it's nice to not be dealing with that anymore. Now I just pass as a normal guy. I walk in the men's restroom, nobody looks at me. When I walked into the women's restroom before, I always got, you're in the girls' bathroom, you're in the wrong bathroom, you're in the, he said, yeah, I know. Like, I know I'm in the wrong bathroom, but there's nothing I can do about it right now. But it's just nice to just not be noticed. I'm not noticed anymore, and I'm just normal like everybody else.
So I actually grew up in South Texas. Well, I started in South Texas, and that was a very densely religious area on its own. So, and then we moved later on during high school into Tennessee. So that's even further south with a different kind of religious constriction. In South Texas, it was very, very Catholic. Everything was just one straightforward way. And then when we moved, everything was closer to like Baptist and I guess non-denominational, really, right? But it still was very, very conservative. And so that was already like a weird like change on its own. But then at the same time, I was also moving into a place where people of color weren't entirely welcome. Also an Army brat. So then you kind of have another culture shock where you're used to at least being in an area where it's a little bit more welcoming, still structured, but not anything crazy. And then you go into an area that is not, but still very structured in a very negative manner. Yeah, if that answers some of that. I only saw like, or met gay or lesbian people, but I didn't understand like what trans was. Like I knew very early on something was weird, and I was looking into things and surgeries and stuff like that. I was like, because I don't want these titties. Like, let's just be serious. Like I didn't want them, and I was like, how can I like make them go away? And then as I was researching, I started realizing that I'm not the only one, and at the same time, there's actually like a category for it, and you can learn from it.
And what age was that at when you realized that there was a whole community?
I think I was 19 or 20. Like it was much later because it was so like it really genuinely didn't exist in the circles that I was in.
Yeah. When I was in like 5th or 6th grade, I told my mom that I thought I was a trans boy. Because I've always been super, I have a very complicated relationship with gender, and I always have. And so when I found out about that in very early school, I told her, and she immediately was like, and again, giant fucking privilege over any experience that you had, because I already know. Her immediate response was being like, oh, okay, what do you want to do about that? Do you want us to go to the doctor, get you on hormones? Do you want me to start calling you he? I got scared. I was like, I haven't thought that far.
But I just wanted to talk about it.
I think I was wrong, actually, because if I wasn't wrong, if I was actually trans, then I wouldn't be scared of this, right? So I backed out. And then got into my social circles where everyone was gay and or trans, and was like, fuck. Never mind, there's more options. I don't have to be okay with that shit yet.
Right, and her giving you that ability to be like, okay, well, do we want to adjust your pronouns, or do we want to go further? That like gave you the option to be comfortable and then search. Yeah. Whereas like when I came out to my mother, because I had to, when I started hormones and just trying to think of what direction I wanted to go, that conversation went terribly, to say the least.
Ready to go back to Georgia where it's warm?
Florida?
Georgia? I guess we'll go with this one.
So I just go through the review, go over, what you said. Before you check in, you'll come and move in the parking lot. Have all your questions been answered, and do you verbally consent to this procedure?
Yes.
Okay, that's done.
Thank you.
Of course.
Scared, nervous. Whole lot of things. Oh boy. Not ready for this COVID test that's going to itch like crazy.
In this post-pandemic world, have to have COVID testing day of surgery. Kai gets here in the morning, stays in his car. Our nurse goes to the car, swabs his nose, does the test. If the test is positive, he has to go back to Georgia and potentially come back. If the test is negative, only then do we go with surgery.
Negative. Look at that.
Hello Kai, how are you?
Good, how are you?
Nice to see you. How was your trip getting in?
It was good.
We're mapping out the pec muscles so we can sculpt them. Flex again. All right, you're gonna be in good hands, my friend.
Thank you so much.
Thank you. I'll see you soon.
Yes, sir.
I'm going to be by you all the time. I'm going to take good care of you. You're doing great. You can close your eyes, think about something good.
Nervous but excited. More excited now than I was.
Yeah.
Maybe pass out for you.
You guys are so cute. I'm just setting you up here with a COVID consent form. And then I'll need you to fill it out as well as a caregiver.
Right, so this is Killian. We're going to be doing a bilateral double incision chest reconstruction with free nipple grafts. They prefer a male chest and no preference for incision.
Fantastic. Can I see my intake, please, with my notes?
Yeah, thanks. Right here.
We're going to be making a male chest with nipples for you. Questions?
No.
Awesome. Thank you. So we're going to do our measurements.
Okay.
And after we do our measurements, we'll then take you back to the operating room, okay? So I'll have you stand up over here, please. Things are going to go fantastic.
I'm excited.
Thank you.
I trust you.
Thank you. People think top surgery or changing the gender of the chest is just a mastectomy. It is not just a mastectomy. What we're going to be doing today is creating shape, form, and physique. How do we do that? We're going to use artistry. We're going to use our knowledge of anatomy, our knowledge of physiology to create the male form. If all I was doing was cutting tissue out, I will leave this patient botched with an indentation. What I'm going to do is I'm going to change the gender to make it congruent with the identity. Let's do it. Welcome to the operating room, guys. It's time for a male chest. What are we going to do? Look over here. Remove the tissue, sculpt the chest, remove the nipple, resize them, reshape them, reattach them. Let's do it. What this is doing is breaking up the gland, breaking up the fat so we can remove it more smoother. Less indentations, less divots off. I'm leaving the muscle intact. I'm not cutting or damaging the muscle. We have a custom nipple marker that we had made for us. This helps me get the most circular nipple in the best shape. Next up is we're going to cut around the nipple and we're going to remove it from its attachments. People forget that the person we're operating on is a whole person. They get focused on just the part they're doing and the part that's exposed by the drapes. What you have to remember is there's a whole entire life, an entire story, somebody's son, daughter, somebody's family member who is covered up right now that we have to keep in mind and think about as we're working the case. People lose their humanity in surgery when they forget we're operating on people. We're not just operating on anatomy. Okay, great. Now we're going to clip the tissues together or put them back. We're doing drainless surgery today, no drains. All right, guys, we did it. Male chest, look over here. Remove the tissue, sculpt it, move the nipples, male nipples. Come look over here. Another one. Nipples line up, incisions line up, contour is masculine. Bring it up, Joe. That's right, one chest. You did awesome, my friend. Okay, I'm gonna see you for your post-op, okay? You take care, my friend. Congratulations.
Thank you. It's done. Finally, the chest you've always wanted.
I have this.
Thank you.
It is done.
So proud of you.
I'm just grateful to be feeling the way I do. I mean, I've been super lucky to wake up and just feel no pain at all. And then I thought maybe today, being it the next day after surgery, I was like, okay, I'm gonna wake up tomorrow and it's gonna be rough. But nope, I woke up just fine. Ate a full breakfast and now we're out exploring Seattle the day after surgery.
Crazy.
It is.
Killian. Hi. Come on back. How we doing? Little sore? I'd be surprised if you weren't. Right this way, you two. My name is Grace. I'm one of Dr. Sajan's PAs. I'm going to be helping out with your appointment today, okay? Sure. And we're going to be right in here. And you've already met Adrian, correct? Yep. Okay, fantastic. Welcome, welcome. Only other person I need to introduce you to is Tina. She's going to be joining us.
Oh,
that's pretty good, huh?
Oh, that was good.
Yeah. Guess what's gonna
describe that?
That's gonna be even better.
Oh, look at it.
Thank you, Tina.
Oh. Man, I never. I wouldn't have thought that was possible. I love it.
You look perfect.
Oh, I love it. And we haven't even taken those off yet.
Yeah, we haven't even taken those off yet. You look so good. You look so good.
Thank you.
I'm crying.
He is so good.
So good. That's amazing.
Man.
Yeah, shoot. Everything looks healthy. Your skin is perfect. Last little tug here, okay? You're done.
That's also satisfying.
Yep, not too bad, huh?
Would you just look at it?
Yeah.
You look so good, babe. Oh, I don't even have to cover my nipples anymore.
We did that for you, huh?
No sense in needed.
Looks really good.
Oh.
Amazing.
Love it.
Right there. Perfect. Alright.
Oh,
Very good. Fits a little better without the foam, huh?
yeah.
Perfect. Well, then we will see you then, okay? Yeah, absolutely. Take care, you two. Hi. Hi. Come on back, you two. How are we doing? I'm good. Thanks for asking. Sorry, it's Stormy, right? Nice to see you again. I'm gonna have you follow me right back this way. Awesome. Welcome, welcome.
Thank you.
Everything going okay? We hanging in there?
Yes.
Yeah, not too bad?
Perfect.
I love it. Okay.
No pain, no meds, no nothing.
Oh, you are a rock star. Perfect. Well, we are gonna go grab Dr. Sajan, get him in here. He's gonna do kind of the thing for you. We'll get you taken care of from there, okay? Perfect. Yeah, we'll be right back for you.
Hello, my friend. How you doing? Awesome. We're gonna take a gentle look, okay? We'll do the unveiling today.
Awesome.
All right, my friend. We're gonna gently open this up, okay?
Thank you so much.
You ready? All right. It's gonna look a little bit fresh, okay? It's gonna be very different. Tina. All right, my friend, you ready? Come by the mirror here. Let's walk together. Okay.
Oh, wow.
That's your new chest. Wow.
That's awesome.
So different, huh? You look ripped.
It's very different.
So everything went amazing. There's no blood collection. There's no fluid collection. We'll take off these bandages today. We put these to help minimize scarring. These yellow things are called bolsters. They're special medicine impregnated gauze that are holding the new nipples on as they're healing. We normally don't do drains, but because you're an out-of-towner, you have 2 drains. We'll take those out at your 1-week appointment.
Okay.
Okay? Have a seat for me. Wow, well, you look fantastic. We'll get those bandages off today. We're gonna follow up with you in 1 week. Important things for the next few days are, number 1, you want to try not lifting your arms above your head, arms shoulder level or lower. Number 2, you want to be careful of strenuous activity. You don't want to do anything too fast, too aggressive, because you can leak a blood vessel and get a hematoma. The surgery went fantastic. It was a wild success, and there were no complications. And we'll get you through the rest of the healing, okay? Any questions about anything? Well, you all are amazing. We're so happy you're here, okay? I appreciate it.
We brought you a party gift.
Oh, you shouldn't have. Oh, no, it's too much. Thank you.
Somebody told us y'all like sweets. So.
Oh, that's so kind. And the SCAR protocol kit is no cost.
No problem.
Okay? So we'll give you the whole kit. Thank you so much. You really shouldn't have. That means a lot.
You guys have been super awesome. People aren't as nice as you guys are where we live. So.
Yeah.
Well, we love you, and we're so blessed that you're part of our practice.
Thank you. Thank you so much.
Thank you. Thank you so much. I can't wait to see what this is.
You might have to fight them all for the container.
I'm keeping it. Thank you.
Come on back. How you doing?
Pretty good.
Good, we'll take it. Right this way. All right, we are just gonna be right around this little corner today. Perfect, happy 1 week. Come on in, you're good. We'll take a look at everything together. Right on. Very good. You look good. I'm just feeling to make sure we don't have any fluid in here. Everything looks perfect. Feel free to pop on over there and take a look at it real quick. Right? That's crazy for 1 week. Yeah. I think that you are just exactly where you need to be right now. Good. Well, this looks perfect, okay? No fluid whatsoever. A little bit of swelling. It's still gonna shrink in a little bit. But for 1 week out, you are killing it, my friend. You look very good. I know. Keep it up. All right. I'm gonna give this shirt back to you. This should not hurt at all. It'll be super easy, like taking an earring out. I will talk to you about what we see and why we see it. First things first, it's perfect. So you're totally good. There's no concern right now, okay? This is intact around the edges. It's attached in the middle and it's got pink undertones, so we know that it's got good blood supply. Those are the 3 things I care about. Got them all, okay? Very good. You ready for the other side? All right, let's do it. You okay? Yeah. Very good. And this one's perfect as well. We've got one more trim and then you are free. All done. Very good. Very, very good. They're perfect. So exact same thing right here, okay? Feel free to pop up and take a look. It's gonna feel a lot more like your chest now that you don't have any weird things on you anymore, okay? You've got tiny little dissolvable sutures around each nipple, but kind of once the scabbing is done, those are gonna be gone as well, okay? Perfect. You got it. Very so good. Perfect. I know, right? You get all the angles. The big dramatic mirror. Perfect. You look good. You look really good. Hi.
Hello.
How are you?
Good. How are you?
I am good. Come on back. Hello, hello. Right this way. I'm just gonna have you follow me around this corner, okay? Happy 1 week.
Thank you.
How we doing?
Really good.
I'm so glad. Right in here. All right. Today's gonna be a very good day. We're gonna get rid of the binder, get rid of the drains, get rid of the bolsters, and you are gonna get to walk out of here with just a shirt on, which is gonna be fantastic.
That sounds great.
Did we finish those antibiotics?
I did.
Okay.
It was actually, I think, in the middle of the night last night.
Perfect. All right. Let's get this off for you. I'm gonna have you take a seat in here for me, and let's get the drains out first. Now we're gonna do a deep breath in and a deep breath out, okay? And when you do the deep breath out, I'm just gonna pull it for you, okay? So deep breath in and deep breath out. Very good. Let's go ahead and do a deep breath in and then a deep breath out. Perfect. Very good. Very, very good. You're done. Bolster free. They're perfect, okay? Here's what I like about it. They're intact around the edges, okay? Attached in the middle, and they're nice and pink, so I know they have good blood supply. Just zero concerns whatsoever with those. Feel free to pop up and take a peek. Everything looks perfect. That feels more like a chest, right?
Yeah, when you have those yellow things on there, they're in different spots.
I know, and they're just not. You look perfect. I've got Kai here. Everything looks perfect. We took both drains and both bolsters out, and he's super happy with the results, so he's ready for you.
Looks like a wild success, Grace.
I don't know if it's stable that way. I didn't ask.
Hi, Kai.
Hello.
Wow, that looks amazing. How do you feel?
I feel great.
You
I've had no pain.
You look ripped, man.
It's been insane the amount of how easy the whole process has been.
Thank you. I'm gonna take a gentle feel, make sure there's no fluid anywhere. There's no dog ears. No blood, no fluid. Looks perfect. The nipples are alive.
That's good news. Yeah.
Have a seat, please. Everything looks fantastic. You're healing very, very well. After our virtual 3-week appointment, we're going to see how you're healing.
Okay.
And at that point, we'll decide your activity level. Until then, we want you to take it easy as you are now.
Okay. Okay. Enough.
Anything else?
No.
Awesome. Congratulations.
Thank you.
I care about you, man. We did it.
Yes. We did it. You did it.
Thank you.
Beautiful.
Hi, how we doing? Nice to see everybody. Hey, Killian. Take a gentle look. I know we had some hiccups, and we're going to see how things are settling, okay? You look amazing. Wow, you look ripped.
He is ripped.
Awesome. All right, let's take a look and see. Have you had any drainage past 24 hours?
A little bit on this one, but it seems it closed up a bit more too.
Can I have gauze, please? Your incisions are healing really well. Your body rejected a couple sutures, my friend, and that's why you have a little open spot there. And nothing to worry about. There's a little opening there. That's from a pop suture. It'll just scab over in a couple days, okay? Your body rejected this one at the end, so we're just going to gently trim it. We're not taking it, we're just trimming it. The suture right there that was rejected. And this side's doing. Are you right-handed?
Yeah.
Yeah. Sometimes people's more active side will have a few more issues because they move a little bit more, so they can pop a stitch.
That makes more sense.
That's right. Your left side looks perfect, healing really well. It's just the right side. You popped a stitch here and a small one over there. All right, bud. Great. Go ahead and have a seat. So everything looks super. You're doing very well. I want to check on you in 3 weeks, just to make sure these little scab areas healed over. There's nothing to do. They look fine. There's no blood. There's no fluid. There's no infection. You're looking great. The cut, the shape, the chisel, your chest is just right. Yes, 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 yes. The nipple scabs you have will fall off in about another week.
Okay.
For the next 3 weeks, I want you to take it easy, but you can go back to gentle exercise. I don't want you to lift more than 20 pounds. Try to limit moving your arms above your head because you can stretch the scars. Because the right side is a little bit more sensitive to the sutures, I want to limit your mobility as far as stretching above your head for 3 more weeks.
Okay.
You're clear to shower. I wouldn't go in sitting water though yet. Everything else looks super.
I did have a question about the swelling on this side.
Yes.
Is that normal?
Very normal. That will get better. You can see it's a little bit more bruised. Sometimes one side just swells more than the other.
Okay.
Nothing to worry about there.
Appreciate it.
It's from the liposuction. Sorry.
Okay.
Cool. Any other questions? All right. So let's follow up in 3 weeks. You're doing great. You'll be cleared for all activity.
Okay. Cool.
All right. I appreciate you, man. Thank you so much. We'll see you soon.
$19 was kind of the base of me being able to like, recognize
what
it,
trans
look it
was,
up, and like,
middle name.
yeah. I think early on, like even in childhood photos, you could tell that there is kind of this like difference, you know, of how I was and how I felt versus everything else. So I think that like on the baseline, the dysphoria was always there, but it got worse as puberty came through, and then you had to have an expectation, whether it be from the Latin side of the family or the religion that, you know, everything was connected to. And then I was just really closed off from things. It was weird. And then like when I started T about 10 years ago, so probably around 20, so around that time still. But prior to that, I had also had a year of counseling, and then at 6 months plus trying to find a doctor that would even take me on before hormone therapy because it was, of course, so like just closed off there. And then even at that point, I was still teaching my doctors at the time what to do and what we should be looking for, and I didn't even fully know.
Like, this is your job.
Yeah, and I was like, I don't know what you're looking for, just like fix it.
So you've been transitioning for like about 10 years now. So this is like the final step for you?
Yeah. I think and I think that's why it freaks me out a little bit more, because it's one of those things that I've wanted, and then you finally get close enough to it and you're just like hyperventilating because you're like, it's gotta happen. Like
10 years in the making.
Yeah. So there's this like baseline idea that like you have to do so many things in order to be trans and then to be passing. But you know, it isn't. It's more about the like comfortability of yourself when you're building yourself and you're trying to come into who you are as a person.
It's about what makes you comfortable, above all else, not what makes society have an easier time digesting you.
Yeah,
Right.
It's like every woman has to have boobs and a vagina. Every man has to have a penis. It's like, no.
No.
That's not how this works. Not how this works. No.
It's 2022. This is not 1952.
So through the course of my 10 years, all the research I had did, no one ever felt just right, you know? So like in Nashville, there is a couple of surgeons that are now specifically in the trans, like cosmetic surgery area. But even then, like you kind of question the validity of a lot of things and the safety there. When I found out we were going to be able to move over here, I was starting to go through all the doctors, starting to go through everything, and literally the only one who had anything written out, as much reviews and positive feedback from people that have met him, was Dr.Sajan. You know, and that, like, I was like, okay, no, now we're at a spot where you got somebody who has done this for a while, who is going to be positive and take care of the presentation, but also take care of you. And so that's, once I like hit it, I was just like, that's the one. I'm gonna wait, that's the one.
So your surgery is next week?
Yes.
How are you feeling about it?
Slightly mortified, but not because of the like lack of care or anything in that manner. It literally is because I genuinely didn't believe that I would have the chance to not have to deal with my chest or any dysphoria or anything else. Sure, I'll feel great, but I'm still processing the fact that I get to do something that is for me and that is a form of self-care. Like, I'm actually bringing myself to the spot that I want. That's why I'm scared.
Well, and have you had any major or any surgery at all before?
No.
Yeah.
I mean, I don't think wisdom teeth count, but.
No.
Yeah. So, I mean,
Big
I would
step.
be hella nervous.
Yeah.
Because
Yeah.
it's big.
It's not even just self-care either. At this point, you're self-love. This is an act of love for yourself, because like care would imply maintenance, you know, like a regular routine.
It's fair.
This is love. Like,
I-
this is the first step in a long process, you know.
Yeah.
I appreciate that so fucking much. I love that. This small group of people has brought me to a spot where I'm comfortable with myself. And knowing that each of them is also going to be there through my recovery just makes me feel a lot better about it entirely, because I don't think that I could comfortably get through it by myself and be okay. Okay, so I had a friend that did this a little over 10 years ago, and not with Dr.Sajan. It was some other doctor in another state in the South. So we already have that answer, right? And he, I would say like closer to 5 years in, couldn't feel from under the incision up to his collarbone. So, like, and I am still within the first month of recovery and actually have feeling in and around, like, around the incision. So that's even more than I would have ever expected at any point. And I'll take it. I'll take it, even with, you know, 2 off mishaps that shouldn't have happened together. But my body is what it is. I'll take it. Got some chips. Oh, I can't reach it. And then I do that. That's a thing.
The
that
struggle is real. It's okay, because you didn't lift your arms.
See? It's fine. It's fine. After 2.5 months after surgery, actually, I am so happy that I had the team that I did with Dr.Sajan in his office. They were willing to answer any questions, no matter what time it was, and it made the process so much easier, even though there was some allergic reactions and things like that. But they were willing to help out, and it was awesome. And I wouldn't be able to move as much if I wouldn't have had the direction or the opportunity to talk to someone when I needed to.
How has top surgery changed my life? I would say that it's finally given me a sense of freedom. I don't feel like I have to constantly hide and wear a binder or any sort of compression top. I can quite literally just put a shirt on, and it is one less thing that caused me so much anxiety that I don't have to deal with now. I don't have to worry if I'm meeting someone for the first time and first impression feels like they're staring at my chest, even if they're not, and me wondering how that's going to alter that perception that they have. It has literally calmed my anxiety and made me more comfortable. I feel like I could do so much more, and saying thank you to Dr. Sajan for helping me find this spot with myself in my life, and also just doing amazing work to where I don't feel like I have to worry as much. It still takes some time to understand that my chest isn't what it was before, but I'm comfortable now. I'm comfortable, and I can look forward to other things now, and I don't know, it's just beautiful.
Oh, it's so nice. Dr. Sajan and staff. Let's see. Oh, so sweet. I want to thank you from the bottom of my heart. Every single person in this office always welcomed me with kindness and a huge smile. Oh, it's so sweet. I can tell you that from all of you, you genuinely love your work. You helped me change my life. I'll never forget any of you. Thank you for this amazing life-changing experience. Wow. Yeah, this is why I do what I do.